I draw the House's attention to my outside interests, and also that this is the first time I have sought to catch your eye, Madam Deputy Speaker, since in any of the COVID debates. And I want to express very strong support for my right honourable friend, the Health Secretary. He has an impossibly difficult job to do, and we should all support him, and in my view he's doing it very well indeed. I also want to express my gratitude and admiration for the health facilities in my own constituency, in particular Good Hope Hospital. And what I want to suggest today is just to encourage a few small changes when they are possible, if I may use a nautical metaphor, an adjustment on the tiller. I'm pleased to see that my right honourable friend is working far more with members of Parliament. The wisdom from our constituencies, as we report back in this House from the front line, I think is very important and should play a critical part in the government reaching its conclusions. I also think that working very closely with local authorities and mayors, not easy, not always elegant, but vital for success, what he wants to achieve, is very important. And in Birmingham, where for many years I've not had much nice to say about Birmingham City Council, I do want to record that the public health authorities under Justin Varney are, I think, doing an exceptional job under the regional mayor, Andy Street, whose leadership we all admire. And it should also be said that Birmingham City Council did a first-class job in dealing with the homeless at the start of this pandemic and making sure they all had somewhere to go off the street. So we have politicians who never agree on anything in the West Midlands, I think it would be fair to say, since March, have worked closely together and have established a very good working relationship. This is not a political crisis, this is a health crisis, and we should all play our part in keeping the aggro levels down, and I thought that the two front benches set a very good example today. In the trade-offs ministers inevitably must make between protecting our health and the health service and protecting jobs, livelihoods and investment, I would push the tiller a bit more towards the economy and economic activities. I'm lost in admiration at the ingenuity and even impressive optimism and vitality of the private sector in Sutton Coldfield as I visit their businesses and hear their determination but also their anxiety. And if I may just mention two sectors. The first is the events and exhibitions sector, which employs 600,000 people. It has a turnover each year of about £80 billion. That's roughly the same as the automotive industry. And Solutions 2 in Minworth in my constituency, which I visited a couple of weeks ago, previously with a £6 million turnover, has had a turnover of precisely £8,000 since March this year. They have 36 staff, 35 of them are furloughed, and they showed me a map of Europe which showed that there was activity in their sector across Europe, in the Middle East and in the Far East, but not, alas, in this country. And they pointed out to me that in Düsseldorf, an exhibition had taken place for the Caravan Show, and 107,000 people had visited it. The second sector I just wish briefly to mention is weddings and the marriage industry. I have seen that this is flat on its back in Sutton Coldfield. More could be done, in my view, to relax the tight restrictions in favour of COVID-sensible arrangements. And I hope perhaps we can show some flexibility in this. It extends to venues like Moor Hall, it's the wedding car industry. All of these things are very badly affected. Now, thirdly, Madam Deputy Speaker, I think I know the Prime Minister well enough to say at heart he is a social liberal, and he dislikes the massive extension of the state as much as I do. The framework of restrictions and ways of living, the language of authority, curfews, lockdowns, compliances, bans, along with the machinery of coercion, informing, policing, snitching, fining. I was horrified to hear this morning that 4 students in Nottingham have been fined £10,000 each for breaching the rules, more than a year's fees. It's particularly the lives and opportunities of young people blighted by this dreadful, that is being blighted by this dreadful pandemic. We probably need to protect the elderly and vulnerable a little more and shield and curtail the young a little less. It's about a touch on the tiller, always a little less didactic, a little more trusting in the good sense of social solidarity of the vast majority. And finally, Madam Deputy Speaker, mental health. I'm a former party member of the APPG, along with Alistair Campbell and with Norman Lamb, probably the best public health minister, or one of them, we've had since the war. We are facing a mental ill health epidemic. people inevitably not being seen who really should be. We must keep this issue very much at the front of all our minds as this crisis continues.